Thank you, Dr. Hirabai. First of all, good afternoon, dear friends. Wish you all a very happy Deepavali. I must thank the organizers for the excellent invitation. When Dr. Rajkumar and the other friends invited, तो हमने कहा भागे भागे चलो. When I came here, I got intoxicated with the love, affection of the youngsters, receiving me at the airport, coming to the dining room, looking after, and my dear colleagues, obstetricians. They will stand tall as far as the Himalayas are concerned. They are so fresh with love and innocence, and it is this beauty, the Rishikesh, a place of innovations. But today I feel lost, My teacher, a great teacher, Dr. Professor Bajaj, a man, a visionary, a man who's an encyclopedia. I have never met a teacher like him. It was his vision that we must have a symposium, and it gave me a chance to be educated today. So, dear friends, I am going to now talk on alcohol and reproductive health. Dr. Hirabai Patel has summarized most of the things that what I wanted to say, and his talk was brilliant, and Dr. Chadda did a fabulous job. But why the hell am I concerned? Being a woman, I'm a vegetarian, teetotaler, and most of the girls are. They said only 0.3%. When India can become the capital of diabetes, can become the capital of as far as ischemic heart disease, I'm sure soon we will be the capital of intoxicating young boys and girls. I'm worried because men and women of teenage, adolescence, reproductive years, and during pregnancy is rising worldwide, and I'm sure we are not behind. Look at it, their sexual functions, organs, hormone levels, reproductive health is deteriorating. Shouldn't I worry? In utero exposure, the poor fetus is being affected, its growth, development, central nervous system, the poor little tiny embryo, fetuses, newborn, and infants. It is one of the leading cause of preventable, which you and I can prevent, congenital abnormalities, important cause as far as infertility. Not only that, it has disabling effects. They are not today. They are for life, my dear. What does it depend upon? The type of the drink you take, the amount that you take, the duration and frequency. Beer is most popular. I'm happy it is stuck to beer. But when people talk of vodka, most of the party marriage, would you like to have a vodka? Ma'am, would you like a red wine or a wine? So you must think twice. Vodka, rum, gin, whiskey, 40 to 50%. Look at the harm it can do. When I talk of drink, mostly we say 1 standard drink or 2 standard drinks. But what does a standard drink mean? 1 standard drink is equivalent to 14 grams of alcohol. And these are the various containers which takes the drink. Secondly, it depends upon the drinking behavior. It can be a low risk, that means no more than 2 standard drinks in a day. It can be a binge drinking. Binge drinking is very popular. You go haywire. If you have not taken a drink, your friends coax you, why not have it? And you feel all right. Let me have it, And binge means 4 or 5 or more drinks in 2 hours or any single occasion. Heavy drinking, more than 6. And I remember quite often when I will quote you an incident. I was in Sweden, and on a WHO fellowship, my boss and other colleagues told me to drink whiskey, neat whiskey. You know what neat whiskey? No water, no soda, my dear. And there was this Indian friend, Kamal, le lo, nahi to ye sochenge tu kahan se gaam se aayi. Now I thought I cannot be dishonest, I cannot drink. And what did I say? I said, sir, Ego, his name was Ego Dick Fluzzi, I have gastritis and a peptic ulcer. So I said a lie, and I excused myself. And this very girlfriend of mine told me to go for a shopping. I didn't say no. She used to take whiskey, full 1 bottle neat every day. So India is not behind. One can take it. We have to find the cause. Don't make judgments. We all are prone to. Like we like to take papdi, chaat, all sorts of junk, realizing. As far as the incidence is concerned, I do not know exactly what the prevalence is. But if you go through, look at children above 15 years of age, 76.8, low risk 32, binge drinking 32, and so on. Centuries people have been drinking. You talk of Somraj, you talk of Patiala drink, you talk of, I remember a girl who came from Manipur. She says, हम तो अपने घर में बनाते हैं. So I got curious, कैसे? Wheat ले लो, grape ले लो, put it underground, which shows our rural people, our affluent class, everybody is drinking. Records are not there. We don't observe it, So we must start observing. It was only a pediatrician who has the third eye of a Lord Shiva, Paul Lemonin, in 1967, he said, alcohol is a toxin. It is a teratogen. It can cause embryopathy. And 6 years later, 1973, again an excellent pediatrician who was doing his great job. And he said, in utero exposure causes fetal alcohol syndrome. Then many years later, by 1996, people came to know various neurological disorders. And then waking up call by the doctors, governments, politicians, and so on. Now here, why am I worried about the youth? I am worried about the young. Our India is young. They are the young who are our future, and they are the young who need to know it. It is in the adolescent where the puberty, I remember puberty is such an important event in one's life. I know when these two girls were attaining puberty, the behavior changes that they were occurring, other things that were occurring. Now what is happening in them? There is awakening of the hypothalamic pituitary gonadal axis, awakening of the luteinizing hormone, releasing hormone, the hormones that controls everything. With the result, the pituitary makes hormones, the gonads makes hormone. And there is maturation and functioning of the ovaries, functioning of the testes, sexual maturity, reproduction. So the parents get worried when their teenagers are attaining a puberty because they think now they can become pregnant, and they start isolating them from the VIP gender, the boys. And then they have the growth spurt. The bone mass is increasing. Their bones are becoming heavier, and they are stronger, and they have the behavior changes. So in this adolescent, if mild to moderate alcohol is taken, my goodness, it is not only the puberty, everything goes haywire. If hypothalamus, pituitary, and the gonadal axis goes haywire, what else will remain, Growth and body composition will be affected, except the age of menarche, but I don't know what the future research will show. The menstrual cycles, which are so regular, and the girls get worried. They think their identity is only with regular menstrual cycle. So if it becomes irregular, she becomes worried, the parents becomes worried, the family gets worried. So these cycles become irregular. They have amenorrhea, some of them. Irregular cycle, no ovulation. And it was a tendency previously to marry the young girls. And if she gets married, she's not fertile because she has got infertility. These are the girls later followed, can have early menopause. And it has been seen that the social drinkers, even small amounts can affect the cyclicity of the menses. It doesn't stay till menses. What does the alcohol do? The beautiful normal relation which God has created. Old bones are absorbed, new bones are being formed, and a nice balance so that I can stand straight. You can stand straight on your feet, But this alcohol, the dragon, it takes the balance. What does it cause? Osteoporosis, reduction in bone mass, in the spine, iliac crest, and lower extremities. What wonders me, and should be the research of you youngsters in India, the osteoporosis of puberty, will it last lifelong? So you have to make answer. You are the best researchers. Be the researchers of today. Animal studies have shown what I have talked recently. Alcohol consumption disturbs female puberty. Drinking during this period affects growth. We say it's nice to be 5 feet 6 inches. It will make you short. Growth will be stunted and bones will be fragile, my dear. Alcohol does not only affect big things. It is very smart, you know. It seeps down to the cellular level. And in the nucleus, what does it lie? Chromosome. So this nasty alcohol goes and alters the chromosome. And if yours and others, mine are altered already, but I don't know if I take alcohol now, it may still call mutagenic, may lead to deformities in the offsprings. Alcohol for people, some who take during puberty, so during adolescence, they may continue, but there are others who have not taken. I remember when we had just entered the medical college, and we were forced by some of our friends who came from a richer class, who came from an elite class, and we were taken to the hostel terrace that let's have the cigarette. And I remember the cocktail cigarette that was offered. I took it and my goodness, I threw it, I started coughing. And that's the time when they say, if you drink, you are the most modern girl, you are the best girl, you are accepted in the society, the demand of the day, you know. So what does this alcohols do if you take later? Female alcoholics have sexual dysfunction. The sexual desire and performance myth is if you take alcohol, probably sexual function improves. No, it does not. Menstrual cycles disrupted, which I have already talked about. The estrogens increase, but the progesterones decrease. If there is no progesterone, little progesterone, the poor blastocyst, which implants in the endometrium, cannot implant. If it can't implant, so naturally pregnancy won't occur. Some who are strong can implant, but it cannot survive and can give rise to problem. Ovaries can atrophy as far as the females are concerned. Early menopause. These individuals who have been drinking, it has been seen that pelvic inflammatory disease is common. Endometriosis is common, but what is the cause? Exact cause is not known. Probably there is an immunological problem. Now, we will talk about our VIPs because everything is offered to them first. First class citizen, first class in politics, first class in profession, first class in the family. Even the sister has to go and bring water for the first class. So I'm talking about my friends. As far as I'm concerned, boys are the best friends. So men, friends. Nothing superiority. God created in that uterus men and women equally. Think equal. They are equal in all respects. So hypothalamic pituitary gonadal adrenal axis activation by as far as the alcohol is concerned. So what does it do? The testosterone start decreasing, poor fellow. The estrogen rise, becomes more feminine. Breasts start increasing. And the activity and the production of LH and FSH starts going down. Sexual dysfunction, 71%. Various forms it is, because Dr. Hirabai may not ring the bell, you know. But please give me little time. Ladies like to talk. But I leave it up to you. It is one of the leading causes as far as impotency is concerned. Now they are very smart, erect, handsome standing. But lovely drinks, what is it happening? Sperm count is going down. The motility is decreasing. The sperms are becoming dead. Majority of the sperms, either the head is big or the tail is absent. Abnormal sperms are. So there is a marked teratozoospermia, oligozoospermia. These poor testes start shrinking and the seminiferous tubules become abnormal. I remember a couple long back, about 35 years ago, this couple came to me. At that time, I was young. I didn't probably think or didn't realize, and came with a secondary infertility. They had one girl child. They said, we want to have a baby. As usual, the poor woman was chosen and did all the investigation, and the man never came. So I told her, she says, मेरा husband तो आएगा ही नहीं. तो मैंने कहा बच्चा उसके बिना कैसे होगा? तो so the man came and we did the semen. You'll be surprised, there was no sperms. and he hated me. He says, मेरा तो बच्चा हो चुका है. मैं कहा हो गया तो तेरी बीवी की भी तो ट्यूब ब्लॉक हो सकती है बच्चे के बाद. अगर उसके टेस्ट हुए तो तेरे भी होने चाहिए. So I left till that. Anyway, then, and as far as recently, only about 2 months back, a young girl came with 6 weeks of pregnancy, and she had an alcohol binge because her brother was getting married. Anyway, so to go further, so what God is so kind to all of us, when drinking is stopped, negative effects on the fertility and sexual function reverse. So if you stop this disaster, if you stop this alcohol, or do not become friendly with alcohol, or take a little sip and throw down the dustbin, it would be good. Now, what has the experiments? As I told you earlier, alcohol doesn't only look at the big things, it goes down to the cellular level. And here in the ovary, which has got, we all girls and the women have ovaries, which I say, the eggs, which is a wealth which we are born with. And over the years, it decreases. And if this alcohol, what does it do? Even the eggs which have not ovulated, it causes chromosomal segregation errors in the pre-ovulatory eggs. So when this egg ovulates, gets fertilized, and an embryo is formed, so it leads to abortion. So alcohol is one of the leading causes of first trimester abortion. Some of the these eggs which are ovulated are strong, sturdy, so they survive till term and result in the birth. What is the type of birth? My goodness, mentally retarded babies are born. Do you want this? No. Now, why during pregnancy it is very important for us? Alcohol passes from the mother's blood to the baby's blood through the placenta, which is so sweet, this placenta. It was the topic of my thesis, placental examination. So it lets all the nutrients. So the poor placenta doesn't realize it passes the alcohol also to the baby. So the alcohol goes to the baby's blood. It goes into the amniotic fluid. The baby is drinking all the time as far as the fluid. We obstetricians are worried when the amniotic fluid is less because the nutrition will be less. And here now the baby, along thinking nutrient, is drinking alcohol, and it is, my goodness, swinging inside, and we think it is moving inside, And the alcohol that is taken by the baby. Second, look at it. The alcohol in the mother may be only about 2 rupees, but as far as the baby's blood, it is twice higher because the poor placenta is so innocent quickly, and the baby's metabolites, the enzymes, are not grown up, is not able to metabolize. I don't want to go into the deeper to youngster to bore you with endocrinology. So that is why it is twice the amount. So this alcohol, as far as I am concerned, it is my enemy, not friend. We can be friendly occasion for the sake of the society, little bit for a sip. In early, it can cause birth defects. Late growth defects may lead to miscarriage, stillbirth, low birth weight, and preterm. But remind you, understand, alcohol in pregnancy from beginning to the end damages the brain. And Dr. Chadha said, what we need brain, dear, we cannot survive without that. In utero, alcohol may lead to various syndromes, which we call fetal alcohol spectrum disorder. And out of that, the first one, fetal alcohol syndrome, is one of that. Second, it could be atypical. Everything is not perfect. God has made different human beings, some white, some short, tall. In the same way, the syndromes are different kind. Alcohol-related neural development disorder, ARD, and other health problem. Why I'm saying is, I was very sad when I read the literature. Only one case of the alcohol problem after pregnancy has reported from my dear country. But when I was talking, I was trying to read. One of my colleagues said, why are you reading? I said, I have to read, because I just want to know. And that is what recent this pregnancy patient came. Second, she says, I came across a case in which the baby was born and the baby was having seizures. For about 2 weeks, they could never diagnose why. And because one hesitates to ask the mothers whether she's drinking. Recently, only 2 days back, I was just wanting to ask, I was going to do a cesarean, so I said, Sonia, what about the drinks? Come on, doc, we in India don't drink. So I kept quiet. I just wanted to know what was her perception. She was a news reader. Anyway, to cut short, that mother's was drinking a lot, and it was alcohol withdrawal syndrome, as beautifully Dr. Chadda said, in the elders. Same happens in the babies. Now, as far as the fetal alcohol syndrome, the other one, neurobehavior cognitive deficits occur in these individuals. But to cut short, 4 major criteria: facial abnormality, brain structure, growth definition. But the proof of the pudding, just as we say, pathologists are the most important. Unless they tell us the diagnosis, we say no, histopathology. Same is, alcohol use must be documented, proved, and then we can label. Now this is a baby which has a facial feature: small eyes, flat face, short nose, indistinct fulcrum, thin upper lip, and the other associated features. The alcohol-related neurodevelopment disorder, which we call as ARND, there is a complex range of disability. Again here, exposure to alcohol must be confirmed. But what is very important, what did I say as far as the facial features are concerned a second before? Any girls from the back? Flat faces. So the facial features are absent as far as ARND is concerned. May have developmental disabilities, including structure, nervous system, and learning behaviors. Now this little baby whose mother has been drinking, father has been drinking, science has found less. I am very sure it must be the effect of the mother and the father both, which is compounded, which you young Indians with research will prove. Can have vision problems, can have hearing problems. Damage to the brain causes difficulty in learning, remembering, like me at this age, can't remember anything, thinking things, getting along with others. Problem as far as heart is concerned, kidneys concerned. As far as heart is, septal defect, you name the defects can occur. Organ damage, bones and limbs, fingers that are not properly due to these lovely drinks that one takes. As far as alcohol is concerned, damage to the baby can occur from the first trimester to the end. That day one patient came, so I asked her about the drinks. I said, do you take? No, I used to, but I stopped when I became pregnant. Then I said, what about feeding? My friends say it is safe. So feeding is not safe because the alcohol passes through the milk. The abnormality, CN, orofacial, cardiac, and various other abnormalities, including atopic dermatitis, behavior and developmental changes, and psychiatric. So during lactation, I have said it is harmful. What is the cause? Exact cause is not known. Various causes: oxidative, prostaglandin, effect on neuron, endocrine gene expression. Maternal alcohol, the proof from UK. I wish the proof was from India. You youngsters, if not done up to today, please, this beautiful institute under Dr. Rajkumar and the whole faculty, be the good researchers and show the path to India that you can do it, and it can be done, and it is possible. Documented that first trimester of pregnancy is the most sensitive. Second, low birth weight and preterm birth is noted if you take more than 2 drinks. Findings also said, now UK people are saying, okay, the developed world, please abstain from alcohol when planning to conceive and throughout pregnancy. What America left, they said we should leave the junk food because we don't want diabetes. We leave the junk food, don't ischemic, and send all to India, all the burgers, because we women can't cook, we are working, And the husbands, IIT professionals, they have no time to help their wives. When husband and wives are working and food is required by both should work equally. Okay. Anyway, so their evidence has said that please stop before and throughout pregnancy. Now, where are these effects? As I said, the delicate placenta, which is so nice, which is going to give nutrition to the baby. So studies have indicated villus infarction, thrombosis, vascular thrombosis. There is a trophoblast proliferation, defective invasion, as well as nutrition is defective. Alcohol has a strong genetic. When alcohol can change chromosomes, I'm sure over the generation, the genetic things are going to change. So the genetic susceptibility to alcoholism has been seen because of these abnormal allele. Genetic susceptibility as far as the fetus is concerned and families are concerned. The effect of fetal alcohol and other conditions are lifelong, lasting. No level of alcohol, somebody say take little bit today, not tomorrow, infrequent. No, this has not been proven as yet. You have to prove. Who can drink? Those factors have been highlighted. Either the mother or the father, somebody leaves, divorce, fighting, beating. Beating is very common in India, I can tell you, because of the male chauvinism, and this especially in the rural areas. They think he's not he unless he raises his hand. Anyway, that's about that. But our young children are very good boys. I tell you, I am surprised the gentleness that they have acquired from the educated parents and parents who are happy, you know. Prevention is the best, you know. I won't use the word abstinence. Nobody likes abstinence. Prevent. Be free. Young minds are the most important. Who doesn't like young? I don't like young. I'm so happy to see the young blood. I was so happy to see the freshness from morning to evening. It is not only the Himalayas, it is you. It is the freshness you breathe, freshness you give, you know, because you don't have fixed ideas. It is over the years that we elders at times don't give you space to think freely, to invent freely. A holistic approach to address sexual and reproductive. Ask questions. Assess number of this. Record. We are weak in recording. We are weak in monitoring. Be strong, you know. Involve parents, teachers, everybody. Adopt youth-friendly. Involve young people. Why? To make principle practice into critical thinking and action. Conclusion. Heavy drinking is bad. Affects female and male. In utero is bad. Since the time is short. These effects are under-recognized, under-reported. You are all going to frame the policy. We will help you. Women who are pregnant or planning pregnancy, please do not drink. Stop drinking. Be safe. Have an alcohol-free pregnancy and have the alcohol-free youth that is concerned, especially the adolescent, the schools, you know. Thank you all for hearing.
Thank you, Dr. Buckshee, for a very informative as well as impressive lecture. Any questions, please?
Okay, thank you all.